Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Jacobs, in this video, I will show you how easy you can do our free online medical evaluation, Ask ASTR. So basically, when you go to askastr.com, you will see this page and you just click on take our free medical evaluation. And when you click on that, if you're not logged in or registered user, you just need to simply register very quickly. And then this is what's gonna show as the free medical evaluation. It literally take 5 minutes to finish this form, and immediately after you finish it, you will see the result. So I'm just gonna go quickly over the form to show you how simple that can be filled out. And so this is like basically the first page is like similar to the page that you will fill out when you go see your medical doctor. It's just a medical release form in case if you have emergency or something like that. So this is a software that I've been working on for several years, and it's basically we included 9 healthcare providers database actually. So it's like you see 9 healthcare providers at the same time. So I messed up in this. Okay, I need to fill this out. .com. Okay. So it's basically is similar to seeing 9 different healthcare providers at the same time. So I did not fill this information, so the system does not allow me to go to the next page. Okay. So this is just the first page is just medical release, and after that you fill out any if you have any medical history. The good thing about this software, if you have a risk factors for life-threatening situation, we included the database for that. So let's say if your heart rate is 160, over 160, you're gonna receive a message. The software will tell you what you need to do. If it's life-threatening situation, you're gonna get that warning, which really gonna help you to know, should I go to my medical doctor, should I go to the ER or whatever referrals you need to go to. The software will guide you to the proper healthcare provider that you might need to see if it's a life-threatening situation. If not, you're not gonna get any warnings, and at the end you will see the warning again. So you basically just fill out the information if you know it. The more accurate you're gonna be with the software, the better the evaluation, the more accurate will be the outcome or the result. So try to be more comprehensive about what's going on with your condition, so the software will help you to figure out the root cause of your issue. So after filling it out, we'll just go next. I'm just gonna go click a few clicks on certain issues that might have, and we'll see what the software gonna do in relation to that. So the software will change the questionnaires based on your answer to really help you to figure out, do you have like issue with any body part or any possible conditions. If I'm taking medication, I'm gonna click what kind of medication I'm taking, and it's very simple, easy to follow. It's all clicks. After your first page of filling your medical, like your personal information, it's just simple clicks, and the software will guide you through the process. So I will just continue hitting next just to show you how easy. I'm just gonna do a few clicks here and there, and it's a basically 12 pages. So literally it should take like around 5 minutes of your time to really finish the evaluation. So it's a very comprehensive evaluation. Actually, we included database for nutrition, for psychologist, for medical doctor, for endocrinologist, for cardiologist. Um, so it's a very comprehensive, of course, for physical therapy, chiropractor. So as you see here, I clicked here by mistake that I have throbbing, cramping pain in one leg, rarely both legs. So the software knows if it's a possible medical emergency, it's gonna show you the warning message. If you click that by mistake, you need to acknowledge the software, or if it's a risk factor, follow the instruction of the software as indicated in the screen. So going forward, and the software will help you. If you need a lab, it will let you know which lab do you need. So for example, I don't have any musculoskeletal issues here, so hit next. And then after that, the last page, it's gonna show me the result. I need to answer this question, no issue here. So the result will not be saved unless you hit submit. So this is a summary of the result here. I have to hit submit in the last page. It's basically 12 pages that takes literally 5 minutes to evaluate, to finish. And I will hit submit, and I will show you now the result page because that is actually the brain of the system. So as I mentioned to you, if you have a risk factor, it's gonna show you the warning. Okay, so now the page before this, it was the page that has all the evaluation that I did it for myself. And I clicked on the date that I wanna look at the evaluation, and this is basically what I'm seeing. So based on your answer, I have recorded several videos to explain how to read the report. You can watch that report that more applicable to you, and I explain it in detail. But here, based on this person answer that they have blood pressure issue, so the software recommend that they need to do a blood pressure cholesterol kit, which is including the diet, the recipes, and the supplements. They actually have immune issue, or they need to improve their immune function. So the software recommended that. So here, it's also, if there is a need of lab, the software will tell you what kind of lab do you need. Just remember, if the software show you the lab here, if you show that lab to your medical doctor might not be familiar with a lot of those labs, because this software, including 9 different database of 9 different healthcare providers. So your doctor might not be familiar with the lab that's recommended here, because your doctor has not done that comprehensive evaluation. That's why if the software recommend certain labs, we recommend just you do the lab in the system. It saves you a doctor visit, and also the system, you just couple of click and you can order the labs and just go to your lab, and the software analyze it for you. So for this situation, I put that I have high blood pressure and I have issue with my immune. So the system is actually list the diseases that was clicked on. So I also clicked on the blood clotting issue, or taking medication for blood clotting. So it shows me, based on intensive research, what possible deficiency that could occur because of the disease. And as you notice here, the same supplements that related to the deficiency or related to the disease are the same supplements that actually recommended by the system. So there is actually over 18,000 studies that our team reviewed before implementing that program. And also there is a very intense research and studies for the database that we included in the system. So for this person, he says that he smokes. So it shows if you have any unhealthy habits and what possible side effect that could happen from that bad habit. The rest of the bad habit will be included in the programs that the software will be recommending. So if you're taking any medication, the software also gonna shows you what possible side effect of medications and possible nutrition deficiency from that medication. And when you look here on the top, the recommendation of the software is actually the same recommendation to meet the deficiency that actually could cause by taking some of the medication, because some patient actually could have side effect of the medication because the medication caused some deficiency in vitamins and minerals. So that's very basically what is Ask Aster free medical evaluation. It's very easy to use. It will save you a lot of time and money. If you have risk factors, the software will lead you to which healthcare provider you need to go to see. If something that you can do it at home, the software will let you know what steps you need to take to really live healthy life. So take advantage of Ask Aster. Just go to askaster.com.